Hello, everybody. It's Dr. Agin with Q&A with Dr. Agin. Just want to start out with saying I am fresh out of surgery from this morning. I had an arthroscopy on my right shoulder, and so I still made it for my Q&A, which is great. But I apologize for looking a little disheveled today. But important topics, so I wanted to come back and have this discussion, especially when it has to do with sexual health. I know during the holidays, that's a big opportunity for people in relationships and loved ones and being around family and friends. So just was excited to still be able to get back here and do this Q&A. So a couple quick things, I want to also let you know that if you have any questions, please feel free to email us at TelewellnessMD so we can answer any questions you might have, because sexual health and sexual dysfunction is such a vast conversation just because it covers so many different contributing factors. So what we want to do is dive into a little bit about what is the importance of sexual health and some of the things that cause sexual dysfunction and some of the opportunities for people to improve their sexual health, because it is that important. And so just jumping into sexual health, when we talk about wellness, health is a component of wellness, and sexual health is a big component of health and wellness as well. Something just happened. I guess I'm still live. Okay. Can you see what's going on with my screen there? So, but anyway, so sexual health is very important. They have tied, not just in relationships, but even into individual self-confidence, the importance of having a good sexual health and wellness. So it's not just for the relationship, but it's also for each of us individually. And they've also found that when you have dysfunction in your sex, that it also can lead to some bigger health problems. For instance, it just went off again. So, for instance, if you have various conditions that can also relate to potentially bigger healthcare issues. For instance, for men that have erectile dysfunction at an early age, that could mean that you not only have a blood flow issue, having to do with erections, but that could also mean that you could have early plaquing or blockage in some of your cardiovascular or coronary arteries. So sometimes there are things to look at when you have these issues. Sorry, having some technical difficulties as well. But when you're having some problems with erections, or even with vaginal dryness for women, that there could be some hormone imbalances or some other issues. But just in general, there's been so many studies about just happiness and how that correlates to sexual satisfaction. And in relationships, obviously, lack of sex in a relationship becomes kind of the norm as relationships go further, and that doesn't have to be. And so when you look at when they've done the research to show that how satisfying sexual health in relationships and individual confidence and how that important that is in life, it's important to obviously look at that when you're trying to improve your relationship. And so they've tied sexual health to improve job satisfaction and to improve confidence. It also helps a lot of people keep their physical, cosmetic side of the wellness up to date, just because with sexual relationships, you also have to look at the issues you might have with how that relates to having your clothes off and your self-confidence. So we know that a lot of people do understand the importance of how that can affect relationships, but what they don't know is a little bit of the backstory of just how common sexual dysfunction is. And so there are a lot of people that are not satisfied with the amount of sex they're having, the quality of the sex that they're having in their relationships or in their life, and really don't know who to open up to, because sometimes it can be embarrassing. But they also think that maybe they're isolated and alone. So, especially if you're younger, but it'd be shocked at the statistics, because as the years are going on, because we talk about our current health state, and that the sexual dysfunction is becoming more and more common in younger age groups. And so you do not have to be embarrassed about it. What you should be embarrassed about is if you don't do anything about it, and then that in turn causes relationship issues or even confidence issues with yourself, because there are several different causes and there are multiple different treatment options for any sort of sexual dysfunction. So I think that's the most important thing, is just realizing, is to just say, is there a problem, and see, is it a relationship issue, or is it something individual? And if it's an individual thing, then you have to start looking, okay, what is the problem? There's things like desire, arousal, pain, lack of orgasm, premature orgasm for men, erectile dysfunction. So there are several different things that could be involved in having, an unsatisfactory sex life. So first you have to identify what the issue is. If it's not you and it's your partner, then you have to open up the lines of communication. And I can tell you right now, communication is the number one way to solve this problem if you're in a relationship, is just being open and honest. And that's not just with if there's a problem, that's also about about sexuality in general. You don't want to hide if there's certain things that you want to have in your sexual relationship, that you're not getting, that you would like to have. I mean, being open and communicating can be a big part of how much fun and excitement you can have in your sexual relationship, and to expand the healthiness of your sexualty. So the communication part of it could actually be turned into fun, because you can actually talk to your partners about what they like, what they were hoping to have be better, and just by opening that line of communication is, how often do you want to have sex? What's the quality of your sex? Is it a timing thing? Is someone going to bed too early? Someone going to bed too late? One finishing early? One being selfish? I mean, it just all can be brought to the surface with communication. So start with that, but on the individual side is just see if there is a problem before you have to get into communication. Because if it's something you feel that is an individual problem, then you can start addressing it by looking at saying, what is the issue? And statistically, there are more women that have complaints of sexual dysfunction in which could be arousal or desire, not an anatomical issue like men get because of the blood flow problem, but women can have dryness. And so it's about 40% of women and 30% of men complain of or have some type of sexual dysfunction. And I think that's actually a lot higher. The reason I think that it's a lot higher is that I think a lot of the men that use some sort of treatment actually don't think they have dysfunction, because the medication actually works for them. But understanding that medication, when we say someone doesn't have dysfunction, that means that they're free of needing any sort of therapy, whether that be a pill or an injection or some type of other therapy to help with sexual intercourse. And so before we go into the therapies, I want to touch on a few more important topics. Is that, when we're also talking about sexuality, especially as we age, I think some people start looking at, if you have dryness or erectile dysfunction, that, they kind of give up on even attempting to have that sexual relationship. And you got to realize that, sexuality is not just has to be penetration. And so, intimacy and having that connection in a relationship could be used, could be found by just being really close. There's plenty of other ways that you can find intimacy without penetration, which is using, oral stimulation, or, even using various, sexual toys that can still deliver pleasure if there's something that's not working. I mean, this is very common for people that go through like surgery, like me. I mean, there's some guys that will go through surgery, some women will go through surgery, women going through menopause, going through hysterectomies. They can't have intercourse for several weeks or months and sometimes longer than that. But it doesn't mean you can't still set aside the time to be intimate and still get close and find other ways to pleasure your partners. So don't give up. That be persistent and understand, because we know the importance of sexuality. Keep that in the forefront of the relationship, because you do not want that to be one of the variables that is causing discontent in your relationship, because sexuality is a very, very common cause of relationship issues, and that is coming from lack of communication. Because I'm telling you, if you're in the right relationship, you should be able to speak openly about any issues you're having with your sexuality, whether it's a personal issue or it's something that you have wrong with your partner and that you're wanting to improve. Because if you don't change it, you're going to stay in the same problem, and it's just going to compound, and then it's going to end up becoming where it does become a relationship issue. So remember, communication is number one. You have to communicate. You have to make sure that you're having these discussions with your partner. We got a question here real quick. Could there be physical issues for lack of sex drive? Well, that's an interesting question, because usually the physical issues are usually very obvious. If you have a physical issue, you are not able to perform for some reason. Like I said, that would be for women, even either having vaginal dryness or dyspareunia, which is pain with intercourse, or that'd be men with having erectile dysfunction or premature ejaculation, or where they get erections but then they can't last. But could that be involved with lack of sex drive, or could there be physical issues for lack of sex drive? I think they're kind of connected, because once you have some anatomical or physical issues, of course your sex drive is going to go down, because you start to lose interest, and that's very common. I mean, it's kind of like running from the problem and then eventually just giving up, and that's whether you leave a relationship or not. So that's a good question, but I think and they're definitely tied together, but yet very separate. Because just the desire and the arousal is more heavily weighted on the women's side than the men. Men usually have the desire and have more desire, but usually have an anatomical issue just because of the nature of our bodies. And women dominate on the sexual arousal or sexual desire side of sexual dysfunction. So, and it is a lot bigger, and again, going back to statistics, it's a lot bigger problem than people think. There is about 5 to 10% of men and women that say that they have not had intercourse in over a year. And that's, understanding how important sexuality is and sexual health is for our confidence in relationships. You can see that can become an issue. And as we as a society are getting sicker, you're going to see that is potentially going to even kind of compound this problem. And so when we look at some kind of going into the dysfunction again, the largest cause of sexual dysfunction in both men and women is just overall health. It's just our lifestyle again, and we go back to how the importance of lifestyle. Lifestyle is definitely going to be have a major impact into your sexuality or your sexual health. You can imagine the better you feel, the better you sleep, the better your hormones are balanced, the more exercise you do, that is going to in turn to increase your chances of having some sort of a desire to have sex, and also improving the quality of the sex. So things like diabetes, heart disease, even kidney dysfunction, advanced aging, lack of exercise, obesity, these are all directly tied to various dysfunction or various causes of sexual dysfunction. So, starting out with what we can do is, again, number one is communicate. Make sure you identify if there's a problem, try to communicate to see if you guys can solve the problem. And then the next one is to see exactly what the issues are. And if it is an individual issue, either on the male or woman side, because of either desire, arousal, or some sort of dysfunction, being it pain, dryness, or not being able to get an erection, then you have it's open, and now you guys can start looking at solutions. And because again, it is that important if you really want a very solid relationship, and if you want to have the benefits of having a good sexual lifestyle, just because it is tied to happiness. So looking at some of the different things that we have solution-wise is pretty neat, because there are tons of options. I usually, with my patients in my office, if someone has kind of comes in and actually brings up the conversation of some type of sexual dysfunction, or if they're trying to see what advice I have, if there's some issues going on in the relationship, because say, hey, maybe they really want to have intercourse, but then their partner is not doing it enough, or having some of their issues. Of course, the first thing I'm going to tell them is to go communicate. If the individual patient is having the issues, then I tell them, look, we have solutions. There's really solutions for both men and women regarding any type of dysfunction you can have. Even for people that have tried everything, there's penile implants. And so again, for men, there is always an option. And if it really comes down to age and you have no interest, then it's just you're moving into the intimacy, where you just try to find other ways to stay close and pleasure each other enough to make sure that the relationship is happy. Now, let's start with the arousal side in women. So women, the main causes for women in sexual dysfunction is going to be desire, arousal, and pain, which is usually coming from dryness as they go over menopause. And so the things that we do for women that have dryness, you obviously know lubrications is an easy one, but that could be a sign of hormone imbalance. And so that's another commonality, is that we would prescribe intravaginal estrogen if the lubricants aren't working. And so that is something to look at. It's very easy to do, and it's not really cumbersome. It's not that you have to put the estrogen creams into the vagina every day. This is something that you do for a couple weeks, and then you start doing it once to twice a week, just to keep the vaginal atmosphere in better condition. So that's a very common one, is that, as you can imagine, if you had a lot of dryness, it's going to cause pain with intercourse, and that's just something that's not going to make the woman or the man happy with. And so the other part of it is the arousal or desire. And so this is a very common problem also. It has some component of hormones, but there's also signaling in the brain that can happen just with age. It can happen with traumas, past relationships popping back into your head, just getting used to in previous relationships which you weren't having a lot of sex, and now you get into a relationship where you have a partner that wants a lot of sex. It sometimes takes retraining the brain and understanding what you need to do. So first, again, it's going to come back to communication. Talk to your partner if there is some psychological issues from past relationships that's coming up, that's kind of making you blunted in sense from wanting to have that sexual relationship. But if there's really no reason at all, and you just don't have the desire and you can't get aroused, then you're going to have to start looking at some therapies. And one would be, again, looking at your hormones. But then we have a couple good ones. We talked about Kisspeptin in a Q&A before. And what's really cool is Kisspeptin is an injectable therapy that works for men and women, because it does have a direct stimulation of certain hormones in our body that can improve some of the anatomical issues, but also Kisspeptin signals in the brain, in certain areas of the brain, that have been shown to actually improve arousal and improve mood. So Kisspeptin is actually an FDA-approved therapy for women for fertility, and one of the parts of that is the arousal component of it. So Kisspeptin is a great one on the arousal or desire part of it for men or women. So please, if you haven't looked at that, look up Kisspeptin and see if you find that might be adequate for you. There's another one called Melanotan 2. That is a very interesting product because it has some modalities involved that don't really necessarily go with directly with sex, but kind of does, because Melanotan 2, not only has it been shown to improve or be used for sexual arousal disorder in women, it also can help somewhat with erectile dysfunction in men, but it's not a number one choice. But the other thing with Melanotan 2 is it also can act as an appetite suppressant and improve skin tone and protect against cancer. And so when you look at that therapy, if it increases your libido for women with arousal disorder, improves your appetite, and also tans your skin, you could see you're setting yourself up for a pretty good situation. So that's another really good one if you are having an arousal or libido issue. There are some studies still coming out with using, Viagra or Cialis with women. I know there are women patients that I've had that have taken a half or taken some of their husbands or partners Viagra or Cialis and had, gotten benefits from it. So there's always that conversation you can have with your physician as well, or talk to one of our physicians at Telewellness MD. So going on to the men a little bit, because again, I told you this is a really expansive category in conversation, but let's talk about the men. So any men, do not be embarrassed if you're having some issues with erectile dysfunction. I use a very good comparison on how easy it is to understand just how fast erectile dysfunction can happen with a man is using insomnia. So just imagine if you can't sleep, and every night you start getting ready for bed, and all of a sudden, boom, you start worrying about not being able to sleep. And people that have insomnia, which is a high percentage of our population, they understand this. They're already getting anxious about not being able to sleep before they even get close to being, going to bed. So you can imagine what happens when you have anxiety. You're basically releasing hormones in your body that signal you to stay awake. It's your fight or flight response, that sympathetic tone that just puts you in a situation where you're already screwed in a sense. I mean, you're already anxious, you're already worried you're not going to sleep, so of course your brain's going to be racing. You're releasing natural stimulants into your body, and so those people have to go through a lot of effort to get that sleep cycle back in place and to shut that anxiety cycle off so that they can actually get sleep. And a lot of times they need therapy for that. So think about that with erectile dysfunction. If you have one episode where you've never had it before, and then all of a sudden you're having intercourse, and then all of a sudden you have a problem, whether it's before you started or as you got started, and you have an issue, that is going to be in your brain, just like insomnia. So you're going to go into the next one already before it could be a week before you even have intercourse, you're still thinking is this going to happen again? And so that's how quickly erectile dysfunction sets in, and that's how fast it can set in, and that you just imagine how hard it is to get out of that, because once your brain starts thinking about it, it's a difficult scenario. And you also have to, I have patients that say that never had problems, and then it happened once, and the next thing you know, they're having intercourse and everything's going great, and they'll just have one little thought, hey, maybe it might go down again, and boom, within seconds it just drops out. So that just shows you the psychological component and how that works with erections. And so you definitely do not have to be embarrassed. It's because it's psychological component of erectile dysfunction is 30 to 50%. Again, I think it's a little bit higher, than that. But with changes in our health, I think that that's going to continue to cause erectile dysfunction to be a lot more ubiquitous unless something changes. So for those that are having erectile dysfunction, there are a lot of different levels that you can start at as far as getting help. But don't be satisfied with not performing. Performance is going to affect your self-confidence, and it's definitely going to affect the relationships, because if you're not communicating, your partner's going to think something's wrong, you don't want them, that you're cheating on them. It's going to be a disaster unless you just be open and upfront with it, or you go get help. So the help that's available, of course, are the very common Viagra and Cialis, which are the oral solutions for erectile dysfunction. And these were drugs that were stumbled across, previous cardiac drugs that are very effective for men, in a lot of men. But the problem is that they can be effective, but yet they also, you have to take it with you, and there is some side effects that go along with these pills in a high percentage of men, and that could be headaches, changes in vision, stuffy nose, and the headaches are probably the most common complaint, and the headaches can be compared to that of a hangover. But in the initial phases, when you're just trying to get your confidence back, deal with the headache, have these available, and then of course utilize them just so you can get your confidence back. Sometimes just having the pill in your pocket is all you need, because just knowing that you have something if you need it can actually it work for you. Just keeping it with you could change your confidence and at least make it so you know that you can perform. Also, the next one that I want to talk about is actually the most important, because I think it's also the one that nobody knows about. I'm just shocked at the percentage of people that have never heard of penile injection therapy. It sounds brutal, but it's really not. And these shots have been around for over 25 years and very successful, because the big part of it is the efficacy and the lack of side effects. So all the side effects that you can get with the oral solutions, the injections don't have those same type of side effects. Yes, you have to put a small diabetic needle into one side of your penis, but the good thing is that there's no side effects, and the efficacy is much, much higher than the oral solution. I would say about 95% success rate, and there's so many different dose or strengths of the penile injections that you can start low and obviously graduate until you get that perfect erection with the perfect duration, and they're very, very satisfying. And so I would say 100% of the men that I have switched from oral solutions to injectable solutions have stuck to the injections. And that's just because it works quickly within 3 to 5 minutes. Very satisfying erections. I mean, obviously more, and that's, when I say satisfying is that sometimes with men that have, don't really say they have erectile dysfunction, but yet they don't get as satisfying erection as they would want. We'll get that with either the oral or the injection, but again, that's another good point, is that don't settle for an erection that's not ideal, because these solutions will work. But going back to the penile injections, is that so even again, having the penile injections in your possession, sometimes men use it only when they go out on dates, that they might drink a little bit more than normal. So it doesn't mean you have to have full-fledged erectile dysfunction all the time to utilize these solutions. It can be used as like a binky, or a what is it? Call it your little blanket, that you carry around. But if you have these solutions with you, sometimes you don't end up needing to use them. Sometimes also, if you're open and you're communicating with your partner, they're fine with if you try on your normal way without any help, and it doesn't work, then you have a solution available that you can go get. So just do not be afraid of the penile injections. There's something I tell any man that if you have suffered from erectile dysfunction or are suffering from it, that should be one of your go-tos, just because it's not much more cost than the oral solutions, and it is less side effects and 100% satisfaction. I mean, again, all the patients that I have transitioned off of the orals to the injections have stayed on the injections. And we're going to have some really good question and answers and video communication with some of our patients here in the next probably 3 to 4 weeks. I think you really should tune in and watch this. You're going to see men from different levels of erectile dysfunction, and how they utilize these penile injections, and how it has really, really changed their whole confidence and relationship by using them. And that's why it's really important that I'm bringing these men in, because I think there are a lot of guys out there that are a little hesitant to stick a needle in their penis. But when you hear what these guys have to say as far as the pain, the ease, and the satisfaction that they get from the therapies, I think you're going to want to give it a try. So kind of winding down on this, because I know I've been talking for a while, is kind of going back into the importance of sexual health. It's been researched, it's been studied. We know even from an individual to the relationship, sexual health is so important on both sides. It can actually reduce depression, it can improve confidence, it's even been tied to reducing heart disease, blood pressure, stress, So you know, there's really good reasons to be looking at sex when you get done listening to me and start thinking about ways that you can spice up your sex life. It is that important, and there's so many things you guys can be doing outside of the therapies that I'm talking about. Just setting up date nights, you know, increasing your foreplay, finding various things to make the person be excited about the evening, to just start setting your whole night up to improve the chances of having a good outcome. And on the dysfunction side of things, just remember, communication is the most important thing. You guys got to communicate in the relationship or you're going to get nowhere. And so now you got to see how this could work against you. So if you're having if you don't have a healthy sex life, you're not communicating about it, that is going to create more stress, and it's going to create more discontent in the relationship that's just going to keep building and building. And you're actually now affecting your overall other part of your health life, not just the sex part. You're actually starting to increase your stress. It's going to cause people to not sleep as much. It just is a kind of a vicious cycle. So I also say that, you know, using sexuality is also a way to motivate you on your lifestyle. We know lifestyle is going to improve many components of sexuality, and so that's a good motivation. Is if you're not having ideal sex, or if you're embarrassed about taking your clothes off, or if you're a man that has erectile dysfunction, you know, these are good reasons for you to get up, you know, improve your sleep, improve your exercise, and improve your diet, get your body in shape, and so you're excited to take your clothes off, and you're more excited for that personal contact. So use it as motivation. So communication, and then identifying the issue, and then finding a solution. So again, remember those therapies we talked about. We have a whole page on Telewellness MD that talks about you know, various therapies for sexual arousal disorder or sexual erectile dysfunction. So, okay, hold on, one question. Oh, sorry. Oh, someone just asked where the penile injections are injected. So I can't really point because my arm is still numb, but if this was a penis, you're going right at about the 2 and 10 or 3 and 9 sides of the penis, and you only have to go on one side for an erection. So you can switch the sides each time you need to do the penile injections. You can switch the sides, but it goes down at relatively closer to the base there, and it goes on one side at the 2 or 3 9 or 10 positions. And again, you don't have to go any very far. The penis is not a giant organ, so you're using a very small needle. Once you've done it, you're going to be like, that is crazy. That was really nothing. And I think when you see the results, you're going to see why so many men stick with them. So and we even have videos that you can see. There's plenty of videos online as well showing you using either some sort of a toy or actually actually having some people do the injections online. So again, do not shy away from the solutions, because the solutions, and just really last thing that I'm going to say for men is that when you use the solutions to improve erections, you can actually improve your erectile dysfunction. Because you got to remember that, you know, I get guys that come in that hadn't had sex in 2 or 3 years, that are in their late 60s, and they get in a relationship and they want to have sex again, and they're worried about, you know, will it work again? And that brings an important point. It's just like, you know, the more it needs blood flow. So if you start having more intercourse and you start having better erections with better blood flow, that is going to increase your confidence, reduce the chances of having a psychological component to erectile dysfunction, but it's also going to improve your erectile function. And so I've had several patients that were using the penile injections, and they got such good erections and were having sex so much more that they noticed that the actual size and look of the penis actually got better, to the point where they weren't needing the injections in a lot of cases. So it was almost like exercise for the penis. And so there's no better way to exercise than sex. So, you know, and if you think that I'm going to let my drop arm here slow me down, that is incorrect. If I can find an opportunity, then I would, that's how important sex is. So I'm only kidding. I don't know if I could actually muster that up with today after having surgery and probably not being able to shower, but I'm telling you, I would try. So that's going to be my last message: is go out, improve your sexuality, improve your relationships, be excited about sex, and look at our page, because we have a lot of solutions, and there's really nobody that should give up on sex for any sort of dysfunction. So thanks again, Dr. A, in Q&A, and we'll see you next week.